morning, ma'am. I'm very good. Thank you so much. How are you doing?
This part, yeah, yeah. Okay.
Do I begin, ma'am, or you have any procedure?
So, communication is the bridge between confusion and clarity. With this beautiful thought, a very pleasant and energetic good morning to one and all present here. It gives me immense pleasure and honor to welcome all the respected dignitaries, esteemed resource persons, faculty members, enthusiastic participants to day three of our prestigious national virtual short-term course on transforming personal and professional growth through soft skills and personality development. This enriching academic initiative is proudly organized by Jabalpur Institute of Nursing Sciences and Research, a NEC accredited and ISO certified institution, continuously striving towards excellence in education and professional empowerment. I am Professor Aradhana Dhanyavad, your host for today, and I feel delighted to be guiding you throughout this wonderful learning session. As we progress in this insightful journey, day one laid a strong foundation with introduction to soft skill and personality development, which was dealt by Ms. Bharti Kashikar ma'am, and day two empowered us with leadership skills, which was dealt by Professor Dr. Princess Shaji ma'am, principal of our institution. And today we are stepping into one of the most vital life skills, that is communication and interpersonal skills for effective teamwork. Because no matter how knowledgeable we are, our success largely depends on how effectively we communicate and connect with others. Communication is not merely the exchange of words, it is the art of expressing thoughts, emotions, and ideas in a way that builds understanding. In healthcare and professional settings, a kind word can heal. Clear communication can save lives. Strong interpersonal skills can build powerful teams. Today's session will help us to communicate with clarity and confidence, build meaningful professional relationships, enhance teamwork and collaboration, understand the power of active listening and empathy. So let us open our mind and heart to learn something truly transformative today. Now it is the time to introduce the guiding light of today's session, and we are privileged to have with us an inspiring personality who has transformed many lives through her expertise. Ms. Shanthi Anand, ma'am, is a dedicated soft skill trainer and mindset transformation coach with over 15 years teaching and training experience. She specializes in enhancing interpersonal skills, confidence building, and personal professional development. She began her career as an educator in reputed institutions and later developed a strong passion for training and counseling, upgrading her expertise through various national and international certification programs. She is certified NLP practitioner, life skill trainer, and has completed multiple courses from American Psychological Association and British Council. Her core expertise includes soft skill training, counseling, communication, teamwork, and mindset transformation, where she helps individuals to overcome limit beliefs, heal emotional challenges, and achieve their full potential. Ms. Anand actively conduct training sessions in colleges and online platforms and has delivered sessions at institutions such as Bharati Vidyapeeth Engineering College and Ram Seth Thakur College of Commerce and Science, Navi Mumbai. She also provides counseling to clients at both national and international levels. She holds academic qualification including BCom, PGDCA, and ECC Ed, along with professional certifications in soft skill training and NLP. Driven by a strong vision, she aims to empower individuals with essential life skills, build self-awareness, and guide them towards meaningful, confident, and successful life. And we really feel honored to have her today as our esteemed resource person. And now, with deep respect, I would like to invite Ms. Anand ma'am to please take over the session. Ma'am, the platform is all yours. Thank you so much.
Thank you so much for the lovely words in form of introduction. I'm really very honored, and lots of thanks and love to Princey ma'am for inviting me and giving me this opportunity. A very good morning, like Aradhana ma'am said, a very energetic good morning to all of you present here, HOD, faculties, and all of the student members. I'm beginning the session by presenting my screen. Kindly show me a thumbs up or let me know if it's visible.
Yeah, it is visible, ma'am.
Thank you. Thank you so much. Before we begin, I just have a simple request to make. As much as possible, I want the students to participate through interactions. Please do keep your cameras on whenever possible, and also to participate in the way of questioning and the lovely reactions that you have already started giving. Okay, so let's get into this topic, which is very important. Like ma'am gave us a prelude. She was saying how important, how it clears the confusion and brings in the clarity in there. And in the field of hospitality, in the field of healthcare, it is more important because in other spheres, at least it will create confusion. But in healthcare industry, it can even create risk if a certain thing is not communicated properly. So today we are going to learn about communication, interpersonal skills, and effective teamwork. I have designed it in this way that since you all know what is interpersonal skills and communication and teamwork and everything, I'm not going to be giving you knowledge on what it is. You all know everything. Okay, I'm just going to give you a recap of what you already know. And as an NLP coach, I'm going to give you some tips to handle some situations. Okay, some of them you might be knowing, some of them can be new to you. So I'm going to give you some tips that will help you. So do watch out, and it's not only for your profession, even in your personal life, those skills can come handy to help you, right? So firstly, like I told you, I'm not giving lectures on what communication is. I'm just going to give you what are the core things. Okay, so now when it comes to communication, we might think that what we speak is communication, whether I'm able to speak properly and whether the opposite person is able to understand properly. But that alone is not communication. That is a very meager percentage of it. So what constitutes to this communication is 50%, 55% is communicated through our body language. 38% is taken care of by the tonality of our voice. And only 7% is what we speak. I mean to say that only 7% of the words reaches the audience or anybody who's speaking to us, which means before even we open our mouth, people have understood a lot of things about us. The way we dress, the way we use our hands, the way we maintain eye contact, the way we pause between words, that speaks volumes, right? So communication means body language also, right? Next is the fundamental tools. Before that, why is this so very important? In every field, whether it is schooling or industries or anywhere, as human beings, we have to communicate. And if we have to be understood properly, then we have to follow a certain method, certain process, so that our communication is very effective, right? So it is fundamental tool for building relationships. Now, when I say relationships, it's not only personal, it's even a colleague, it's even the relationship you have, means the way you talk to your peer group, to the people who are in little lesser cadre than you. Everywhere communication matters. And once you communicate properly is when they are going to cooperate with you. Without cooperation, it is going to lead to a lot of conflicts. So communication helps us to build relationships, and then it helps us to establish trust and enables collaboration. And I'll just want to ask a question about collaboration, but before that, I'll finish this. So personally also, professionally also, it is very, very important. And what impact can it create when we communicate? Firstly, our thoughts are transferred. The other person's thoughts are transferred to us. Secondly, it helps us to build a connection. Without connection, nothing is possible in this entire world. Whether even now, through online, we all are sitting in different states and we are connecting only through communication, right? So, and this connection and communication allows us to bring the transformation, which is very important in healthcare industry. It is very, very important because that's where you all are coming into picture. You all are having healing hands blessed by God. Chosen people that you are, nurses and doctors are chosen people. Not anyone can become a doctor or a nurse. So you have those healing hands. That's why God has given you this opportunity to serve human beings, wherein you're bringing their transformation in their physical, mental, emotional well-being everywhere. Okay. Now, I just want to ask a question. What is the difference between teamwork and collaboration? Can anyone answer that? You can put the answers in the chat box, or you can even unmute and speak if possible. Is there any difference between teamwork and collaboration?
Ma'am, I can try. I'm
Yeah,
not very
please.
sure about it.
Please.
Teamwork is your team. People are with you all the time. Whereas collaboration may be from the other disciplines or other companies. That's my take. I'm not very sure, ma'am. Thank you.
You're right, ma'am. You're right. Thank you so much. Anybody else would want to try? Okay. No problem. I thank you, ma'am, for giving me that reply. Yes, you are right. Teamwork is, let's say, all of the nurses are working together. That's a teamwork. But when your doctors, your chief, your surgeons, your maybe everybody, your everyone comes in one team, that will be called as collaboration. For instance, in your college, all the students can be one team. When the students, the faculties, when the office staff, okay, and your college dean, your HOD, your principal ma'am, everybody comes together to for a cause, for a unanimous cause, then that brings collaboration. All right. One more thing is teamwork happens when all the people are almost in the same cabin or maybe slightly different. Collaboration happens when different knowledge, different, like ma'am said, different sector or department, different department people come together, put in their expertise and work for one goal. That's what is collaboration is all about. Okay. Now, before we move further, let's play a small game. Okay, like I requested, please do participate, everybody. Let's make it interesting and interactive as well. Not that only I'll be talking and you'll have to be listening. All right. So this is a small game where one person will have to start a story. Okay. One sentence they will begin of the story. And then I will throw the curveball. And the curveball will be, I will say a word which is unrelated to the story. And the second person will have to bring this unrelated word in the story, start with the first line told by the participant before. Am I clear? And we have to continue the story like this. Thank you. Come on, who's going to begin? Please unmute and participate, everybody.
Yes, ma'am.
Please, Anmol. Go for it.
Yes, ma'am.
Rashmi, yes, Rashmi, please try. You can begin
Ma'am,
the story.
I can begin any story I want to, ma'am.
Anything, anything.
Okay, ma'am. Ma'am, in a village there was a farmer having two oxes who used to help him plow the field.
Okay,
One was
hold on.
Hira, one was Moti.
Okay, hold on. So the next participant will have to repeat this line that Rashmi ma'am told and use my curveball. Okay, the curveball I'm throwing is pineapple. So now you have to say that story that Rashmi ma'am told and bring the word pineapple and use it somewhere in your story.
The former, there was a man who had two oxes, but he went to buy a pineapple,
Okay, he went.
leaving the oxes at home.
Okay, it was not at home, so he went to buy a pineapple. Who's the third participant?
Ma'am Sabina.
Sabina, please.
Uh, Ma'am, the farmer who used to use this Hira and Moti, they used to cultivate pineapple in their field.
Oh, okay. Now my curveball to you is cheesecake.
Hira and Moti, after finishing their work, the farmer used to treat them with a cheesecake to pamper
Lovely,
them.
lovely, lovely. Let's keep it going. Who's the next one? Continue the story,
Yes, ma'am, Pramila.
please.
So in a village, there was a farmer with two oxes, Hira and Moti, and he went and bought a pineapple, and his wife made a cheesecake which also had pineapple, and it was very tasty.
Okay, but I guess Sabina ma'am, I guess she told that he bought the cheesecake and treated the children, right?
Okay.
Okay. So next participant now. Come on. Let's keep
Ma'am, I'll add on to it. I'll add on to it.
Please,
Ma'am,
ma'am.
in a village, the farmer who had oxes named Hira and Moti used to buy cheesecake to treat his oxes after the work.
Okay.
Bought pineapple to make it pineapple cheesecake so that they enjoy the cheesecake more better.
Okay. So my curveball to you is Cinderella.
Ma'am, the story goes like the farmer with two oxes, Moti and Hira,
Mhm.
went out to get the pineapples and they celebrated with treating with the cheesecake. And uh, that's how they bought the pineapple and made the cheesecake also of pineapple. And the dream was to attend the ball where Cinderella would be there. So these all efforts were towards that.
Awesome, awesome. Well done, all of you, all the participants. Well done. Thank you so much for participating. You are making it very entertaining and not learning, not a boring thing. Okay. Thank you so much for that. Now, can anyone tell me what did we learn from this game? How helpful was this game? Nobody is volunteering for this. Okay, let me tell you. This game told us how much important listening is, right? Because by the time it came to the third or the fourth participant, the story had all the curveballs in it. Well done. But the story sort of diluted somewhere where the main elements became like somebody bought it, somebody made it. So this game helps us understand about the importance of listening skills. Okay, do we agree on this? What happens is, thank you so much. What happens is many a time we all are good at listening. But you know what mistake we all do? We listen to reply, not to understand. We are always in a hurry to reply. Okay, if that is a question, what do I say next? We are already processing it in the mind. half the context is lost there only, because we want to reply and we don't listen for listening purpose alone. So we have to develop this habit, and in your particular field, it's very, very important, because even if a wrong medicine, some sin became jinn, or sign something, something rhyming, it can cause a huge risk, right? So listening skills is very, very important. I to just emphasis on that, we played that game. Let's continue. So what are the foundations for effective communication? There are many foundations. I'm just pulling out all the top 3, top 4 and putting it in the workshop for you, because it's a vast topic. Communication, teamwork, interpersonal skills are all separate soft skill topics. Thanks to Princey ma'am for trying to squeeze in everything and add more value in this 1.5 an hour for you. She has brought up whoever has come up with this title, I thank them for this. Now, foundation is clarity. Basically, when we have to be clear about what we are going to speak, okay, that's when the listener also can be able to can understand what we are speaking. Next is, we all assume that communication means talking, but communication means first listening. We have to listen to ourselves first. That's when we know whether we are blabbering something, we are pronouncing properly, whether our thoughts are going in an organized manner, or we are just running with the words. We just want to finish what is inside your brain. You just want to throw the words up, right? So if you listen to yourself is when you will become a good listener, and then you will make the other person also listen to you well. And the next thing is non-verbal cues. This is vast topic, okay? Let's say you're entering a room. There's a patient over there and you're just entering. You haven't spoken a word. By the minute you entered, within 30 seconds, people get to know about you. I am not saying this. Surveys are saying this. Even when people go to an interview, you're going to an interview tomorrow to get employed in an hospital. The person who's interviewing you can just decide in 30 seconds whether he's going to ask you all of the questions, whether it is worth the time that is spent with you in the interview process. Can you believe this? Again, this is what the survey says. So it means body language and non-verbal cues are so very vital. The way we dress, the way we walk, the way we breathe, the way we sit, whether you go and take the chair all by yourself, you just pull the chair, or you're in a hurry to sit down before even asking to be seated. Many, many things goes into this non-verbal cues. Okay. Next is emotional regulation. That's very important. We all know that. Without emotional regulation, nothing is possible, right? Today, let's assume some of you are in a very frustrated mood. Whatever I'm speaking is not going to enter beyond this, because you're already frustrated, irritated, and you feel like, why this lady is boring me. Suppose you're in an urge, you're in a mood you're very happy, you're eager to learn, you're feeling like, what's this person going to tell me? What am I going to take away from this? That emotion leads to a different behavior altogether. Same person, but that emotion that's in your brain, that mind, that changes everything, right? Now, behavior is often emotion in disguise. Just think about that line. Our behavior, like I told you, depends on the emotion. So when you're irritated, your behavior changes. The way, even though the person opposite to you doesn't have anything to do with it, it changes. So behavior is nothing but a disguise. It is a disguise of emotion. So if you see anybody, you can understand what is running in their mind, what is playing in their mind that causes this kind of a behavior. Okay. Next is small moments create biggest impact. In your field, more than 100% true. Everybody, this is true. Okay, let me tell you a small story to help you understand this one. So there was this old man who was admitted in the hospital, and he was in room number 10. Okay, he was there for close to 6-7 months or something. For a long time he was there, because he did not have anybody to attend to him. He did not have any visitors. He was all alone. He didn't want to go also. So for some reason, he used to be there in the room only. And he was a little cranky patient. He was identified as a cranky patient because every nurse who goes and attends him gets very annoyed, very irritated, because the person keeps on bothering them for one reason or the other. So I'm not saying they became this way because of certain stimulus from outside. They had to call him a cranky patient. So there's this new nurse who joins the hospital. So the night duty nurse was there, checks out, and then she says to the day duty nurse that, okay, now you're a new joinee over here. you've been given this room number 10 patient. I'm telling you, he will not let you sit for 10 minutes also. He's going to trouble you every single minute, and you're not going to have a peaceful day. I'm sorry, because it's your first day as well. And then the nurse goes. As soon as she leaves, bell goes, and it's room number 10. So this new nurse rushes to the room to see what was the reason why the patient was calling. The patient saw this person, this new nurse, and he said, can you just adjust my pillow? See, he wasn't very critical and all. He was fine, but then he had to take some rest over there in the hospital. That is the scenario. He could very well do it, but then he wanted the nurse to do it. So he says, adjust my pillow. So then the nurse makes it comfortable for him, and she leaves the place. Within the 6th minute, again, bell goes, and it's room number 10. Again, she rushes this time to the room because she thought, just now he had called, maybe there's an emergency, that's why he's calling me within 5 minutes. She rushes to the place. And then he sees that. He says that the room is very cold. Can you just adjust the temperature of the fan? Okay, she did that. And then third time she left. Again, the call comes. Then he says, the window is giving me a lot of light over there. Can you just adjust the curtain? Every single time it's like, can you just put the blanket on my toes? I feel cold on my toes. All silly reasons which he could have easily done by himself, given the fact that he was not that very impaired and all, okay? So then finally, when the nurse has been called for the 7th time, she goes inside and she asks the patient, sir, what do you actually need? Please tell me what is the actual problem. And the patient says, can you just hold my palms? Because I feel alone. I feel scared. So the nurse understood that he has been doing this only to avoid being alone. He feels like there's nobody coming to visit him. There's no relatives. There's nobody on the planet for him. So he wants to make that human connection. That is the reason he's been doing this, connecting. Like, at least that minute I can see somebody in front of me, that somebody will come and attend to me. So this has been the thing that is playing in his mind. So what the nurse did, she did is, she put the palms on the palm of the patient and she held it for some time. The man felt so comfortable, so warm, and he felt like there's somebody for him. After which he started healing very fast. And within a month, he even left the hospital feeling very confident and nice. All that the nurse did was a small gesture, right? She accepted, she put her palms and asked him, made an effort to understand what really happened, rather than become pissed off by his behavior. So the smallest of the moments are only the ones that create the biggest impact. The healing happened 80% of the medicine, and this 20% because of what the nurse did, or you can even treat it vice versa, based on 80% this side and 20% that side. Okay. So the small gestures, the small understanding, the small inquiries that you people will do as nurses will go a long way in healing, right? If the patient heals very fast, your reputation is going to increase, your hospital or the clinic reputation is going to increase, and you feel good as a human being. Next, empathy is not just an extra thing, and particularly for this field, it's not an extra character at all. It is a mandatory thing, right? Now you see 3 different gestures on your screen. Can one of you tell me what the first gesture means to you?
It's okay or fine, first one.
Okay, great. Okay or fine. Next one. Anybody else? What does it mean to you? Students, please do volunteer. I see 78 participants over here. Let's keep it going fast. Let's not waste time. Please do volunteer.
Next is anchoring something like what, how.
Okay, asking what, how. Well done. And Kashish wants to say, come here. Okay, great. Okay, I'm here for you. Okay, this thumbs up says, I'm here for you. Well done, Aisha. Well done. Anybody else? Okay. Everything is all right. That's superb. Parveen, that's superb. Yeah, we say, everything is fine. We say thumbs up like this. Okay, next is asking what. Yeah, like Anmol ma'am said, what. We say what, why, all this. Well done. So let's go to the next emoji, next gesture now. What is this one like? What does it mean to you personally? The second one. what happened. Okay, inquiring what happened. Parveen, yes, somebody else. You is it not like asking somebody's hands? Give me your hands, kind of. Come with me. Give me your hands, kind of. I feel that way. Anybody else with any other thought? What does it imply to you? Okay,
It is
that's it.
wait. For me, it is wait.
Wait. Okay. Okay, I get it. Wait. All right. Let's go to the third one now. What does this stand for? In your mind, what does this stand for? Hold. I am there. Okay. Very nice. Anybody else? It's a high. Okay. Oh yeah, that's a high. You say high like this. Correct. Very correct. Next. Stop also. Well done. Okay, Krishna. It's stop. Next. What else can it interpret to you? Oh, it says wait. Okay. What about this? I need help. You put your hand up and say, hey, it's me. I want something. I need help. 5 minutes. I'm coming. Wow, that's great. It says 5 minutes. I'm coming. Well done. I'm so happy you all are interpreting it in such beautiful ways. Okay, let's proceed further. So now what I want to tell you through this small game is that it's just the same gesture, but it is interpreted in million different ways to each one of us because we are different as people. And also we will be in different moods throughout the day. So one time it can look like I need help. One time it can look like 5 minutes, I am coming to you. Yeah. Other times it's like, oh God, I'm fed up, just stop it. Same gesture, it's like wait. So it can just mean different things to different people because as human beings we are different, and our way of using the body language is also different. So this can be all okay. And what do you want? Correct. So we need to understand how the non-verbal communication happens. I hope this slide clearly tells us that how different gestures can be misinterpreted or interpreted differently by different people. Okay, so body language plays a very important role. That's my point. Thank you so much. Now let's move ahead. Communication with patients. Now, when we talk with patients, what are the key things? There are, like I told you, many millions of things I can tell you on this, but I'm putting all the top 3 ones over here so that we can cover maximum in this workshop. Firstly, empathy. See, empathy, what is the difference between sympathy and empathy? Can anyone tell me? Is there a difference, first of all, sympathy and empathy?
Empathy means putting oneself in their place.
Yes, very good.
Sympathy means you are feeling their problem, you are sharing it with them.
Well done, ma'am. Well done. Very good. Absolutely whatever ma'am said. So empathy is you put yourself in their place, and sympathy is you're sorry for them. You understand them. You care for them. All that is there. Only thing is you're not stepping into their shoes. That's the difference. All right. But as people, we'll have to have empathy. We have to understand what the other person is going through. All right. In the field of nurses and doctors, empathy is core. That's why it is in the top. Next is when you communicate with patient, you have to first be empathetic and understand what they are going through. See, when does a person come to the hospital? Only when they are hit by some kind of vulnerable situation in their life. Nobody volunteers. Otherwise, unless you're employed and you're getting a good package, nobody wants to go to a hospital. I'm talking about the common public, okay? So something went wrong, some vulnerable stage of their life made them come to the hospital. And when we are there, that is a place that we have to understand and accordingly cater to them. That's when they heal faster. And when they heal faster, like I told you, you feel good. You get a lot of blessings from God as well as from those people. Because like I told you, God has already chosen you people to be those magical hands for them. All right. So this empathy plays the first thing. And secondly, it is difficult situations you will have to come across many a times. Why? Because sometimes there can be accidental discovery. Like the patient comes in for something, but then they get to discover something else. Some other big ailment is there for them. So they were not even expecting this. So they can be shattered. They can cry bitterly, they can be shocked, they can faint, anything can happen. There can be very difficult situations. You have to calm down and handle those things in a very normal and easy manner, right? By being there for them. And then that is the difficult solutions that you have to give to them many a times. And then clear instructions are very important, because there are times when a lot of colorful 1, 2, 3, 4, 5, 6, 7 colors of tablets can be given, and then the patient might not know which one to have first, which one should be had only once in a day, things like that. Okay. And probably certain words it misspelled. For instance, instead of saying high blood pressure, somebody says hypertension. That can create a tension, because colloquially we use certain words in a different manner, right? So by mistake, some words are used like that. That can also create, that word can play in the patient's mind and in the relatives' minds 100 times. And it spreads also. The patient will tell to the relative will tell to their relative, and it spreads also. So just imagine how important and powerful the words that come out of your mouth are. Very, very important, right? So how can we do this in a the tips that I told you, no? So how can we achieve this? I understood the importance. Now, first is empathy. What you have to do is just validate their feelings. If you do this, you achieve empathy. For example, I'm going to give you an injection. It will not pain. You're such a big man. Are you panicking? A small injection. It will just be like an ant bite. No, it's not like an ant bite. That's a lie. It is painful, correct? But we want to make them feel the pain little lesser. So we try to compassionately say that things, but that's not helping. What will help is if you tell them, yeah, I know I have to give you injection. Yeah, I know it will be painful, but don't worry, this is going to heal you very fast. Now, what I did is I validated their feelings. If I told them it is not going to pain, they'll feel like, oh God, she doesn't even understand. He doesn't even understand. But if I say that, yes, it is going to be pain. You're feeling nauseating? Yeah, I know this tablet does that. Oh, when this fever happens, yeah, people do feel nauseating. Immediately, the patient will cooperate with you. You have won their trust. The cooperation will be very good. Your job will go smoothly. Okay, you're doing good to them. That is a different thing. But your job is taken. Otherwise, you have to convince them. Then they will be telling what all they have to go through. Then there's a big thing like you have to be talking and addressing to them. That keeps on happening, right? So the best thing to do is the minute you validate them, then everything falls into place. They're very cooperative. They are helpful. They have built their trust in one go. All right. Next is whenever you're handling these kind of difficult solutions, you have to ask yourself, did I explain the why? For instance, you're telling them that they have to go for this scanning or that ECG, whatever. So suddenly they might not even be prepared for it. But the minute you tell them the why, we are going to gauge this thing of yours. By doing this, we are going to get this thing of your health report. Immediately, they will cooperate by explaining the why rather than what to do. Instead of saying, go to that room, do this, you got to, wear those kind of scrubs and all that. Instead of saying what to do, tell them why you are doing this. Immediately, the patient will trust you and cooperate with you. Okay, because they will know that they must avoid a certain thing if they do this. And lastly, your instructions should be very, very clear. Now, for that, what you should do is use these numbers. Tell them first, do this. Second, do this. Third, do this. Instead of saying the sentences in three, same thing you will say. But if you number them, it reaches very fast. All right. Let's proceed further. Thank you. Now, when we all have understood now why communication is important, what are the non-verbal cues, how it is playing a vital role, everything we have understood now. Now, I want to tell you that even though you're intending to speak properly, to be, to keep your body language under control, everything you're doing well in advance from your side, still there can be barriers. Barriers means obstacles. There will be barriers. Now, the minute we understand that there will be barriers, we are prepared. As simple as that. The minute you understood, okay, there will be times when people will not understand, Maybe they will misinterpret also. Maybe they will forget some things also. Maybe they will add something to whatever I told and say, nurse ma'am only told this, nurse sir only told this. Can happen. The minute you are prepared about this, you will never ever get angry with the person who does this. Okay, so that you're preparing for the barriers. There are three types of barriers, very important ones. One is common barriers, cultural barriers, and then emotional barriers. So when it comes to common barriers, I am not going to tell you what are the barriers, but I'll tell you what you should do during those kind of barriers. Whenever you're facing these kind of barriers, what should you do? Firstly, this SBAR technique. Do you know this technique already, students? Probably you might be knowing, being in this field, or maybe if not, it's okay. Let me tell you. If you know, please listen to me one more time. So this is called a standardized tool. Okay. So here what happens is, if you're in an emergency situation, you don't have lots of time to communicate to think about, okay, whatever Shanthi ma'am told, this has to be 1, 2, 3, and my pronunciation is this, my pause is this. No time for all that. All you have to do is SBAR, which is situation, background, assessment, recommendation. Okay. This tool will help you and save you during tough times. How does this work? For example, there is a patient in the second floor, room number 12. Okay. And let's say the patient has fainted. All you have to do is, situation is, where is the situation? It is in the room number 12 in second floor. Room number 12, second floor, patient fainted. Assessment is low BP, high BP, whatever you want to assess it. And then the recommendation. What is the next thing to be done? You are communicating this message to the next nurse. Maybe you're on the go, you're running in the corridor, you don't have long time to converse everything. Only this is the place you need to go. This is what you do. This is what I assess. And this is what I recommend. Immediately action will be taken, and the easiest way to communicate. And this can be done even in our homes. It's not that we can do it only in professional setup. Even you're rushing in the morning, you need to reach your hospital at time. Then you can do only this need to be done. All the rest is done. Okay. Next is implementing this teach back technique. This is very important because you all are dealing with patients. You all will be dealing with patients of different age group, different languages as well, right? So please ask them to tell you what they heard or what they understood. You are telling them 2 tablets twice a day. Whether they heard it the same way, ask them. If they repeated the same way, it means they understood. If they made it like 2 tablets once a day, it means gone. So you will teach back. Ask them to this method of teach back. Second method is, this is for talking with your colleagues and your seniors and all, seniors or doctors, everybody. So if they are saying something and you heard it, you tell them, I heard this. This is what you said. Like, did you say 5 mg of this tablet? I heard this tablet. Because like I told you, this fin can be there, sin can be there, zin can be there, many different, it can be rhyming. So you can just say 5 mg of this is what I heard. Is that what you said? So no confusion. Tomorrow there will not be any conflict saying, I only told you this, you only did this. That blame, there is no room for such things. You can't keep quarreling in a place where there's complete peace, right? Next is jargons. Whenever you're talking to the patients and to their relatives, avoid the jargons. Jargons are the technical words that are used in every industry. So being in a hospital, you all will have a certain way of certain words. You all will understand that word. As a common public, we will not understand. So you shouldn't be speaking those words to us. Okay, that is avoiding the jargons. Then the barriers can be eliminated. So why these barriers are there? Because people don't understand what we are saying. So they cannot, you can use these tools to solve that problem. Next one is reducing environmental noise. Sometimes you are saying something and the stretcher is being pulled, or maybe the door has been shut, or the lift has been, collapsible gate of the lift has been pulled. The words will go away. Maybe they can't hear something. So there's important thing that is to be conveyed. Do take them to a calm place, take them to next place, next room. If you have to discuss something about the patient, do not discuss it right in front of them. So take them to a secluded place nearby and then convey them. So if you follow all of these top 4, 5 things, then common barriers can be solved easily. And then you will have another barrier. You want to convey properly. You are very good at communication. You have all the skills, you have practiced it dedicatedly. But then barriers will be there in various forms. One form is common barrier, we saw that. Second form is cultural barriers. In India, we all are from different states, correct? Different languages. Yeah, many of us don't understand the other person's language. Hindi and English comes to our help all the time. We have so many different languages and so many different traditions as well. Yeah, so language barriers have to be remembered. I am saying this, what did the patient understand? Did they understand this way? If they did not understand, what is the next step that I have to do so that some error doesn't happen, it doesn't fall on your head? All right. Now, the next one will be health beliefs. No, this is another barrier because some people believe in allopathy, some people believe in Ayurveda, some people believe in various different. We have n number of medicine streams in India. It's not that nothing, this is wrong or that is right. Everything is right. Okay. As long as people believe and as long as they get healed, it is okay. It is working fine. So that is the kind of mindset we all have in India. So people might not cooperate with you. They might resist when it comes to taking tablets. They will say, no, I've never taken a tablet. Don't give me tablets. You give me an injection, or vice versa. They can dictate you. Actually, you are the person who has to tell them that this is to be done this way. But then because of these beliefs that in Ayurveda, we never used to do this, but my son only got me here. You know, those kind of dialogues you got to hear. So those kind of conflicts will come up. The minute you are aware of this, no, you've won the battle. Then you will know how to tackle it because you will not be surprised when people say this. All right. Next is non-verbal form, norms also. Now, misinterpreting eye contact is a big thing. I'm sure many of you know that maintaining eye contact is disrespectful in some of the cultures. Do you agree with me? They say when you speak to the elders, do not look at their eyes, look down. In some other cultures, they will say, I am speaking to you, where are you looking? Right? So what is disrespectful here is respectful out there. So non-verbal interpretation can be there. So you have to remember this can also happen. So when that happens, you will not be alarmed at all. Next is touch also, because your nursing students, you'll have to touch the patients. You have to ensure that they don't misinterpret it. Yeah, sure, I'll do that. Gayatri ma'am, I'll do that. So they shouldn't, misinterpret it in the wrong way. Your touch is because you're in a therapeutic place that you're touching them. But for them, what happens is you're entering their personal space. See, in general life, when you stand, you won't allow anybody to stand in within a span of 2 feet. Okay, that is a personal space. If somebody, even in a bus stop or in an elevator, somebody comes that close, we are immediately going to turn and look at them and maybe give a stare also. That's the personal space. But then, due to your profession, you have to enter the personal space. You have to touch them, maybe swab certain parts of the parts. It is mandatory for you to do that. But you know what you're doing, but it shouldn't be a wrong interpretation on the side of the patients. And that is also because of culturally, they say, how dare you touch me, send me this, ma'am. And in opposite genders also they can call. So that is also their barriers. Okay, these things will not let you complete your communication is what I'm trying to tell you. Next is social hierarchy will be there. So you listen to the instructions of your doctor, your senior, word to word. You are very well organized. You are going and revealing it to the patient. Patient might not be ready to listen to you. They will say, no, we don't decide like that. We'll have to ask this person because he's the eldest in our family. We will listen to whatever he says or she says only. So your words stops there only. The barrier is there. It's not going beyond. All right. So this is the family hierarchy and systems like that. You shouldn't feel like, why are they disrespecting me? No, it is not about you. It is about their hierarchy. All right. We will have to decide. This member only decides everything. So we have to wait until the person comes. Things like that can happen. So your communication doesn't reach the patient at all. And the last one I'm going to tell you here is implicit bias. This is very important. All the other 4 things I told you are from the other side, but this might happen from your end as well. Why? How? Let's assume there was this 60-year-old a person who was very cranky with you, or who was always very non-cooperative at all times. Okay, even though you were very kind to them, you were trying your best to be kind, and you used all the techniques that you know. Now you see another person, same age group, somewhat resembling that person. Automatically, your brain will tend to think, "Oh, this patient again. I got one more like the same." You never know. You didn't even go and talk to them. You don't even know the person, but even in teaching field this happens. One student last year was a naughty student, and the teacher had a tough time dealing with that student. No, next year the same name will remember, oh God, one more of this naughty notorious person I got, even though the child has not done anything. This is the implicit bias. As human beings, we do have this kind of bias, but now that you know this, you will avoid, because you will be knowing the fact on this. Okay, lastly in this is emotional barriers. Now you want to communicate, but then the message will not reach the opposite person. It will be stopped. It will be blocked. How? Because the patient can be very anxious. They are not in the frame of mind to listen at all. Because of, like I told you, accidental discovery, or maybe they know something, and the fear of the diagnosis is so predominant that they can't even listen to what you're saying. Half of the stuff is not even entering their ears. Okay, that can be one reason there your communication will not reach the other person. Second one is very important. Many people do go through this in different fields, compassion fatigue. Now, because you're all in this place where you're serving the others, there can be a situation, or there can be a day or moment in your life wherein you feel numb. You're exhausted, feeling all that empathy, sympathy, care, pity, everything gone. You feel like hundreds of patients every single day, pain, yelling, tears, crying, grumbling. You sort of become numb. Please don't let that happen. If it happens, I'll tell you what to do. But I'm telling you, there is this kind of a barrier also. In that situation, suppose a person is emotionally numb like that, they will not be able to go and tell the thing in a way. I mean, say, hey, you have got cancer. Is that the way somebody should receive that message? Because this person has gone through it and been dealing with it thousands of times in their life. So it has become numb for them. It's like, one more. For you, it can be one more patient, but for them, it is the first ever time something is happening to them, right? They are dealing with something. So please do not allow that kind of emotional fatigue to happen to you. Okay, that is very important. Next is grief and loss. As people working in the hospital place, there are a lot of chances that you might have to go through these scenarios where you have never dealt with grief and loss and people crying, bursting into tears, and tough situations. You may have to face them a lot of times. You are also young students, right? You are not prepared for it, but there will be times when you will have to go through this, and it will attack you. I'll tell you some NLP techniques to come out of it quickly. I'm going to give you those 2 tips as well. So please stay with me with the same focus. So this can be a place where you are not able to communicate. The patient is crying or not at all in a position to listen to the next instruction. So your communication will not reach them. And you are in the grief. It's like, let's assume this way. You were in a theater, you did everything possible. Okay, doctor asked you, you gave everything went well, but something did not go well, which you don't even know. It was not in your hands. And because of that, some unfortunate thing happened over there. It can attack you. You will feel emotionally disturbed. You will feel like, oh God, 5 minutes before things were normal, things were fine. How did this even happen? That can be very overwhelming for you as a person, right? So that is called as emotional paralysis. At that moment, some nurse comes and gives you an instruction. You are not in a frame of mind to listen to it. Nobody can. All right. These are the emotional barriers that one can face in having a communication. And the next one I'm going to tell you is power imbalance, which of course you have to take control of. Like the patient is in a very vulnerable stage of their life, like I told you, and you as nurse have an upper hand over them, right? So you should not misuse the authority that you're having over them. So because you can do anything and they won't even know whether it is right, wrong, whether it is, of course, you all, you have your, that ethics to do that. But I'm telling you that when you're frustrated or whatever, that upper hand thing, that should not be there. The power imbalance should never play into your mind at all. Then the moral distress. This is caused when, you did everything right And then because of the system, because of the resources, something failed. That becomes a huge disruption in your mind. Okay. So let's take a very quick recap on all the communication factors that we've discussed so far. We understood what communication means, what even body language and non-verbal things, everything. We understood why it matters. It matters because it makes your job very, very easy. You become the trustworthy person, even for the patients and for the doctors. You're going to shine and come up in your career very quickly. You're going to be the wanted person because you understand, and people, you know the tics and tactics of bringing the patients under your control, under your trust. All right. So that is a real impact. And then we saw what are the effective ways to communicate. And then with patients, what to do, and with what are the barriers you can face as well. All right. Now we are going to let me tell you those tips as well. Okay. That I'm having those tips here. I'll share it with you. Let's move to this communication management. Are we enjoying learning and recapitulating all this? Thank you so much, ma'am. Thank you so much for staying there, fully focusing. Thank you. Thank you so much. Let's continue. Thank you, one and all. Thank you. Okay. Now, conflict management. This is also very important when it comes to communication and all. Sure, I've shared the PPT with Princey ma'am. She will definitely share it with you. All right. Next is conflict management. Now, conflict means you all know. Okay, we don't want to do have a certain kind of argument, and nobody likes argument. Okay, but it does happen. So, why these conflicts happen, and how to resolve all this? We are going to see this. See, guys, whenever we have this anger, whenever we are angry at somebody behaves in a certain way, also know that is the simple tip to not feel that anger or not get triggered by that anger is that you understand that person. What makes them angry? If you go to that and understand that, they will only dancing to their temper, but you will be unaffected. And it's very, very important for your feeling, because patients might be, because of their pain and irritation, and they did not even prepare for it. They had to stay in the hospital for a month or a week, and they are bringing out all the frustration on you. No, you don't deserve it. So you know how to safeguard yourself from those kind of emotions. And when you go home, you're not carrying all of these tired, fatigued thing to your home. And there are those lovely people in your family who don't deserve this as well. Correct? So when we know how to manage the conflict, success is all ours. Now, there will be roles in any organization. There will be roles. Okay, the roles are assigning the roles are very, very important. Without roles, nobody will know what to do. Like, for instance, a person enters the room. One person rushes to the saline. Another person rushes to the BP equipment. Another one goes to and gets a syringe. People know their roles, so there is not even a second waste of time over there. They're able to do it. Imagine the same situation where they did not know what to do. Two people running to the same things. And then they thought, okay, I thought you were going to go there. Yesterday you did this. Why did you come here? Every day I only do. They say every day you only do. Today I thought I will help you. Lot of chaos. And there's no room to do all this in this sector at all. So role are assigned for everybody's easy and smooth functioning. All right. And confusion, to avoid that missing gap, no, that is why roles are being assigned to us. And resource scarcity can also be one reason, wherein somebody did not come, so you had to compensate for them. Or maybe there are days when supplies will be limited, so one person has to rush to do a certain thing over there. Equipments can be there can be a mishappening, and a throng of people coming in, 20 people coming in one go, so the equipments can be completely busy and staff can be completely busy. Those times conflicts can happen. The minute we know this, okay, during these times, so even if the other person is in a hurry or in a frustration, you will not get triggered. You don't have to dance to their tunes, right? You can be controlled. So if one person is under control, there is no way there is conflict going to happen. It needs two people to have a conflict. And communication gap can also be a reason for conflicts. Like one can misunderstand and say that, no, yesterday you told me like this. That can be. And another huge thing for conflict, I tell you guys, we can bet on this. This is the tone. The tone plays a lot of role. Yeah. You told the patient, come or come. Huge difference. You said the same word. You are ready to attend to them. But that tone, that felt like I am not going to take treatment over here at all. And nobody knows what happened. You are also puzzled. Yeah, because of the tone. Very, very important. People, people are converted into those unwanted, to do unwanted things also, but they speak in such a nice, sweet talking, and people make others do anything. Tonality matters a lot in your field. It is very, very important. Because of this, my dear students, please don't think you're doing a big favor to the patients. You are doing, but you're doing a favor to yourself. You are winning their trust. You make your job simple, right? Because otherwise you will enter into argument. You have to make them understand, and then they label, oh, that nurse did this, oh, I don't want this nurse, they want to go and complain to somebody. Why all this chaos? Why do we complicate all of it? Rather, the tone makes you loved. Rather, people tell you, I want this person, can you arrange this person? How great is that? You feel good, your day goes well, you're able to squeeze in many things, you're able to guide other people, and everybody wonders, what magic do you have? Yeah. Can anyone tell me what is happening in this picture? It is about unhealthy and healthy conflict. Can anyone just interpret what you're seeing in this picture?
The way the things are communicated, including verbal and non-verbal communication, the person gets convinced to do the thing, and another is like he's aghast.
Okay.
Thank
Very
you,
well
ma'am.
done. Very well done. Thank you, ma'am. So we see a contrast of healthy conflict and unhealthy conflict. Is there even a healthy conflict? Yes. Two kinds of communication on the same situation. Well done. Parvati, very good. Thank you so much. So there is the conflict can also look healthy. Yeah, you're in the health sector, no? So your conflict also will be healthy. Forgive me if it's a bad joke. Okay. Health and unhealthy situations are there. So there will be situation. There are three things, okay? One is passive, another one aggressive, and then comes the explosion. These are all unhealthy. Passive is you don't want to talk to the person. For example, your let's say there's a conflict between your peer group. The first thing that you will do, passive, is you don't want to hurt them by your words. So you will go to being passive. You won't even talk to them. You will avoid them. That is also conflict. Second is you get very aggressive. You've been avoiding them. You did not talk to them. You did not want to hurt them. But one day you totally lost it. That is aggressive. Explosion is the day you blasted them, gave them left, right, center. Yeah. Is that the only way to deal with this? Not at all. Let's see how we can do it. Absolutely. So let's see how we can do it. Now these two guys are roommates. Okay, college goers, roommates. Now this person, the one who's sitting over there, his exams are over. He's just relaxing after his exams, so he's just ordering food. You can see how he has cluttered the place completely, piled up the plates that he had of the plates of yesterday's and day before yesterday's everything. You can see 3-4 plates over there, because of which cockroaches have come out and the place is stinking. And our Rahul, he enters the room thinking that, okay, tomorrow I will get up at early in the morning, 5 o'clock, and I'll start my work. I'll revise everything and finish and give a mock test also. He's thinking all this and entering the house. The minute he sees this, you can see how organized happens there, everything. So he loses it. So now in the way to healthily, in a healthy way to deal with this is that you will get annoyed, you will get, everything will be there. But what you do is a small trick. Instead of going and telling the person, you did this, can't you see what clean it today? in this, you can see that I was stressing on the you a lot of times. But the same thing for a healthy conversation, what we will do is, I feel little difficult. I want to prepare for my exam. I want to wake up early tomorrow. Can you please clean the clutter by today? Tell me, is there any way that I provoke the opposite person? The simple and effective way to deal with this, instead of your you statements, use I statements. If I were you, I wouldn't do that. That's all. The magic happens. Conflict, there is no conflict. Even in your personal life, I'm telling you. You tell me, you annoyed me. You irritated me. You're always like this. We use these sentences very loosely. But if is that all? Is it that the other opposite person is, you've given your remote control to the opposite person, that they will press the annoy button, you will dance annoyed. They will press the irritate button, you will dance irritated. Because you're saying, no, you annoyed me, which means you've given the power to the opposite person. Is that true? We can have our remote control in our hands. Don't allow anybody to push your buttons. Okay? You have a happy button, you have a well done button, you have an enthusiasm button. Push those buttons and enjoy your life. So this is a simple trick. Instead of you statements, use the I statements, and conflicts can be resolved. Apply this in your workplace also. It will be very easy. Okay? So this is the tip. Thank you. Thank you, Jitesh. Thank you, Manisha. Thank you so much. So now, to resolve, all you have to do is, I feel this. Even in your personal life, tell them, don't tell them you know what you did. You did this. Instead, I felt this when you did that. That's it. They will immediately understand, oh, I made you feel like this. When guys, and when I learned NLP, I learned this also, which is called as mirror neurons. And y'all are, very equipped to talk about this. So you all know what neurons are. So this mirror neurons is one thing where we mirror the other person. That's why whenever we see, even in a movie, there is some emotional scene happening and tears are running out. Many of us sitting in our couches at home, tears will run out of our eyes also, because the mirror neurons are mirroring. They are crying, you also want to mirror them. Same way, when a person is angry, your mirror neurons get triggered and you immediately become angry. They raise the voice, you raise the voice immediately without anyone telling you. You must have noticed it many a times, right? So when you keep your volume under there will not be any trigger at all. All right. Next is, supposing you have a tiff between your colleagues, two nurses. All you can do is, okay, I'm not in a frame of mind to listen to this. Let's take a time out, come back to us 15 minutes. Give me 10 minutes, I will definitely talk about this. Give them this assurance, and then either you will cool off, or that other person will cool off, or the problem only will cool off, and there will be no conflict at all. Apply it in your personal life and your professional life. These are simple techniques. If we follow this, just imagine how much of, there will be no BP, no high blood pressure and stuff like that, right? You will be hale and healthy to attend millions of people and tell them these techniques also. Now, focus on bringing this is very important. See, whenever, even between, partners also, partners, friends, or boss and colleagues, subordinates, anywhere you can fix this situation. They will be talking about the issue related to the company. Suddenly, the conversation will become about them, and they both will start quarreling. Even at home, maybe you and your mom is discussing about, do you want to set up an AC at home in this bedroom or not? Suddenly, it became a fight. Why? Because unknowingly, the conversation did not stick to the AC alone. It went personally. So whenever the conversation goes, like you never understand. Whenever the conversation goes personally, bring it back to the situation. Remember that I have to keep the focus on the patient. We are not discussing or fighting because we hate each other. We are discussing about the patient. In that we are having a conflict. Keep that in your brain, and there will be no room. These are the simple topmost techniques I've brought for you to come out of your conflicts very, very quickly. Next is interpersonal skills. Again, this is very important. So we need to build. Ma'am, can anyone tell me how long I have? Am I just going? Is there any time schedule Till how many minutes am I left with?
15 to 20 minutes more.
Okay,
They have
okay, I'll round up before that. Thank you so much. So this interpersonal skills are there. So you have to, these are very important ones. I'll just rush with these components. These are the components of interpersonal skills. So if you have awareness, if you have self-awareness, you will be able to regulate your mood. Okay. So self-awareness is, what am I feeling? So even when you enter an interview, tomorrow you might be going for hospitals to get employed over there. Before thinking about how the interview is going to go happen, whatever, think about what is going on inside of you. Be aware of your own thoughts. Whether you're nervous, then that's when you will know, okay, I'm nervous, I have to calm down. Whether you're anxious, okay, I'm anxious, that means I have to be courageous now. I have to relax now. So when you know when you're aware of your feelings is when you can regulate your emotions. And next is motivation. Motivation is very, very important. Every single day, when you step inside the college or maybe your hospital tomorrow, what you have to do is be very motivated. Tell yourself that those kind of affirmative sentences that says that I'm the chosen one. God has given me this work. Out of all the million people over there, he chose me to do this job. So I'm going to do it all with all my heart. Motivate yourself, and motivation, I'm telling you, will not last for the entire day. It is very temporary, but it is very, very important. All right. Next is social skills. Do make friends outside your circle as well. Apart from nurses and doctors and anybody, please have friends from other domain. And when it comes to empathy, please, you have to control your empathy as well, because in the empathy, your mirror neurons get activated. You also sit and cry with them. You go and you also get into the loop. Who will take care of both of you? That's the thing. So sympathy is okay, but empathy under control. In this, you can see there are two people over there, and there's a cranky patient. So let's see how the nurses are attending to the cranky patient. The patient is very irritated, and the patient shows all the yelling upon the nurse. So nurse A goes, and he feels like, why do I even deserve this? What did I do to listen to all this? He gets irritated and he comes off. He just takes time out and comes off. And nurse B goes in, and nurse B understands that he is yelling. It is about what is happening within his body. He is angry because of his temperament. It has got nothing to do with me, right? There's nothing personal. So the minute you think that, you don't get into their loop, you don't lose the temper, you don't get irritated, all that. Like I told you, I'll give you a simple NLP technique for this. Even in your personal life, you can use this. Somebody is throwing the words that you did not want to hear. You don't deserve those words at all. What you can do is, you can imagine those words. Let's say they said, what an idiot you are. Just imagine those words, what an idiot you are, falling down on the floor and crushing. The minute you do this, it'll be funny for you. You won't take those words and you will not act according to their temperament. You will feel like, I don't have anything to do with these words. Okay, so you safeguard yourself. Another technique you can do is, you can imagine yourself being inside a glass jar, a big glass shield. Okay, so whatever they are speaking is not coming inside. You're very much protected inside that. So you're able to see them, but it's not coming in because you have a very big, huge glass shield around you. Do apply this during those emergency situations also, where you are losing, they are crying, there's burst of tears and all that. Put yourself, imagine yourself under the safety shield, and then you will feel safe. You can do this at various times. Whenever you're tense, whenever you're scared, or whenever you're frustrated, whenever somebody is treating you in a way they are not supposed to treat you, don't go and argue with them. That's the level of their maturity. They are going to do that. No point. You're not going to do them, or maybe give them enlightenment in 2 minutes by explaining all this. Protect yourself, because you are very important to the planet. All right. Next is teamwork in nursing. So the roles I told you, it is very important. Collaboration we've discussed. So I'm going a little bit fast over here. Working under pressure also, I told you, right? Whenever there's a time when you have to work under pressure, tell yourself, okay, this is also a technique I'm telling you. Let's say you're in a general ward and suddenly for a loss of manpower or something, they are calling you, you have to rush to the ICCU. While you're going in the lift or while you're running in the corridor, tell yourself aloud, tell those things, I'm running to this, I'm attending to this. tell it aloud, so that immediately your brain will adapt your body and your physiology according to that. So then maybe there's a very non-cooperative patient. You can tell yourself, and you'll never feel bothered about their behavior henceforth. Okay. So this is about the importance of role. And for collaboration, yeah, ensure your safety. To reduce your workload, there will be collaboration. You have to work in tangent with the others also. Streamline your communication and build trust. I told you how you can build trust, and it will improve your outcome in a massive manner. Now, this is very important. I'll spend some 2 minutes to explain this. See, dear students, see, you will be having situations which are very unwelcomed. Nobody wants to have a bad day, correct? So, but then since you're in this field, you'll have to see blood, you'll have to see things that you've never ever imagined in your life. How do you deal with those high pressure situations? I'm giving you 3 tips. First is, the minute you want to calm yourself, something happened in a room and you're done with that, you're coming to the next room, but then the emotions are traveling with you. How to immediately come out of it? All you can do is breathing control, that you all know. You're very experts in this, how breath helps. So inhale 4, hold 4, exhale 4. And the next thing I can tell you is, this I told you, verbalize those words. And the third one I'm telling you is, suppose you're not able to calm down. Okay, your breath is not under control. Your emotions are very high. You saw something which is very horrifying, whatever. How do you ground yourself? Or even aggressive situations, how do you ground yourself? Quickly touch 4 things. Okay, whatever is around you, touch 4 different things. And hear 3 sounds. In that room, what are the 3 sounds? 1, you're hearing my sound. 2nd, you're listening to the fan sound. Maybe some honking is going on there. 3 different sounds. And then 2 smells. Maybe your own spray, body spray, or maybe some smell, something in the room. 2 smells, and 1 that you can taste. Maybe a cup of coffee, maybe a sip of water. Immediately, 5, 4, 3, 2, 1. This will ground you immediately. Trust me, it works like magic. Now, very quickly, going to this assertive, I want to tell you this very, very important thing. As nurses and doctors, and as human beings in general, we have to be very assertive. Assertive means without hurting anybody, putting your thoughts across. That if you want to do a certain thing, you will do. If you don't want to do a certain thing, you will tell it in a firm manner without even hurting anybody. That is being assertive and confident. Okay. Next is I will want to, before I end the workshop in maybe 6-7 minutes, I'll want to tell you this story. See, maybe some of you must have come across this one. This is a frog. Let's call him Freddy. Okay. First of all, Freddy is put in a burner, and then there's some water. He's enjoying. He feels like, wow, what a brilliant way to enjoy a day. Later on, they are heating the burner. So the water gets warm. And Freddy is enjoying the water because it feels so nice. Okay, he's enjoying it. It's pleasant environment for him. Later on, the burner is still active, and the fire goes up. Okay, the heat and the temperature goes up. So he feels it very, very hot. Just imagine what will happen if he chooses to be there. He will be cooked up. But if he chooses that, okay, the temperature is getting beyond my control, I'm not enjoying this temperature, and he chooses to jump out, he survives. I want you to apply this to the situations that you are in your family, in your life, in your school, in your college, in anywhere in the country, wherever. There will be situations which you are not able to comply with. You have to take a call. Because there is adjustment, there is limit to adjustment. You can say, I'm adjusting, I'm forgiving, I'm tolerating. You can say all this, but there is the limit to it. If you keep on doing this, people will keep on expecting this from you. Okay, so the minute it gets uneasy, just like it did for the second burner, you have to, maybe it is workload in your office, it can be workload. In your family, it can be some emotional pressure that you're not able to handle, and you know it is not your problem to deal with it. Some people can come and keep on feeding your ears with a lot of family issues and problems and complainings and all that. One day you wonder, but why am I supposed to take this? Go to a therapist, go to a psychologist, go to somebody, but why do you come and dump it on me? They will feel relieved. You will feel very emotionally drained. Any kind of situation, when it happens, when you're not comfortable with it, take a call. Say no. Stand up for yourself. That is very important. And standing up for yourself is not weakness. It is strength. Okay, please perceive it as a strength. If you don't stand up for yourself, who else is going to do it for you in the planet? Yeah. So we have come to the end of the session, and one action plan question I want to leave the session with. I want you to be thinking about this question. Think of one habit that you're going to change after this session, one skill that you're going to practice today onwards, and what is the one mindset shift that you got. If you can, please put it in the chat box as well. So please take home these questions, and it will be worth it. Okay, that one mindset. I'm a mindset transformation coach, so I know how mindset works brilliantly. Every patient saved and recovery supported relies on your powerful communication. You can tell them and kill them, or you can tell them and save them. You have so much power in your words. Please use your words, knowing that you have so much power. Okay, trust you establish with your team. And by mastering these skills, you aren't just improving your teamwork, you're becoming the vital heartbeat of your concern, of your organization. Thank you so much. An investment in knowledge pays the best interest. You all have invested and made the wisest decision to invest in this soft skills training. Your faculties are lovely people. They want you to be trained and see what all knowledge that you're bringing to the platform here. They're hiring people from all over India and doing this wonderful gesture by bringing the brilliant of the brains together. So you have made a brilliant decision by investing on that. Thank you so much. I hope really it was very useful, and you all have been really very good and cooperative and attentive audience. Thank you so much.
Thank you. Thank you so much, ma'am, for such a wonderful and insightful session. And now I request the participants, if you are having any doubts, any query, you can ask the questions to ma'am and clarify your doubts.
You're most welcome. Please do ask me any questions or any tips, or maybe if you want to say those tips were very good, or you're going to tell me that this is the action plan I'm going to take, we can have a conversation now. Okay, I think all are very happy and
no questions are
comfortable
there.
with this session.
Yes, ma'am. So, really, ma'am, your session was really insightful, and you explained with the help of games, different stories, your personal experiences, and lots of examples. And it was really a wonderful and insightful session. Your words were not just informative, but truly inspiring. The way you explained communication with the real life examples and practical insights has made this session highly impactful and relatable. I am sure all the participants have gained valuable skills that will help them in their academics, clinicals, and professional journey as well. So thank you so much, ma'am, once again.
Thank you very much, one and all the faculties and dear students and everybody. Special mention to Princy ma'am for bringing me in here. Thank you, and would love to be connected with you all every year. Thank you so much. Very honored, ma'am. Thank you so much.
So thank you so much, ma'am, once again. And there is a notice for the participants. So as we continue this journey of transformation, tomorrow we will have our another 2 sessions. There will be 2 sessions tomorrow. In first half, there will be a session on team building, and that will be taken by Professor Dr. Shanthi Tisa. And another section will be on second half, and that will be taken by Dr. Reena Matthew, ma'am, on the topic of self-awareness and personal growth. So be on time, stay motivated, and stay encouraged. Now, this is time to express our gratitude. So I take this opportunity to extend my sincere thanks to our esteemed resource person, Ms. Shanthi Anand, ma'am, for sharing her valuable knowledge and making this session so engaging and insightful. our respected principal, ma'am, Professor Dr. Princy Shaji, ma'am, for her visionary leadership and constant encouragement. Thank you so much, ma'am. I would also like to thank the organizing committee and IQAC team for their tireless efforts in making this program a grand success. And last but not the least, all our participants for your active participation, enthusiasm, and eagerness to learn. Your presence has truly made this session meaningful. So before we conclude, I would like to leave you with a thought, that is, the way we communicate with others and with ourselves ultimately determines the quality of our lives. So with this line, once again, thank you so much, everyone present here. Stay tuned, stay motivated. See you soon. Thank you.
Thank you, ma'am.